Good morning. So glad you can be joining us on this little bit of a chilly November day, but it's going to be a beautiful one nonetheless. Chances are a lot of you watching are gearing up for the holidays, preparing for Thanksgiving and Christmas ahead. Hopefully that brings some joy your way, but for many people, this can be a challenging time of the year. So it's a great time for us to have Charles Miller on the show with us. He is with Scenic City Neurotherapy. Good to see you this morning.
Thanks for having me.
We actually have lots of things we can cover in the course of our conversation, since I opened it up about the holiday season and what can often be an emotional roller coaster for people. Let's talk about that, because you're able to help people through that depression.
Well, yeah, this is a hard time of year, and usually things come to a head when it starts to get dark earlier, and if people with family traumas, whether it be the lack of family or the stuff that comes down that we pass on generation to generation, around the holidays, all seems to kind of come to a head, and that's one place we see a lot of people start to come in looking for help.
We haven't talked about what that help is that you offer. You do ketamine infusions at Scenic City Neurotherapy, and that's becoming more and more commonly talked about. I think in the beginning people were a little bit confused about how this works, but you've done a great job of educating people, which is part of your focus.
Yeah, absolutely. Without education, it's really hard to understand. There's a lot to it. So we've been treating nerve pain disorders, chronic pain disorders with ketamine infusion for years and years. Only for the last 15 years or so has it been looked at for neurooptimization. And neurooptimization means we help the brain communicate more effectively. And we've seen significant reduction in certain mood disorders like depression, anxiety, PTSD, OCD, and bipolar disorder, just to name a few. Those, it's all about getting the brain communicating effectively and making the person function optimally. And when their brain is functioning optimally, these mood disorders have less of a hold.
Just when I think I'm going to hone in on one part of what you do, you'll mention something else for how these treatments are beneficial, which is kind of the whole point, that if you are somebody and you deal with chronic pain, which the nerve situation could be, right, nerve pain would be, or a mental health issue like PTSD or depression. Your chronic pain could be something different like fibromyalgia. These treatments can be beneficial for that entire umbrella.
Right. It's all about helping your brain communicate with your body effectively, and that's where we see these pain disorders like fibromyalgia, complex regional pain syndromes, and a multitude of other nerve pain disorders. It's an inappropriate stimulation of pain, and so we help reset that.
Okay, let's talk then about the month we're in, then we'll jump ahead to the month of December. But November happens to be a month where you focus on nerve pain, is that right?
Yeah, it's Nerve Pain Awareness Month, or Nervember, which is a funny name, but it's one time we like to speak out and let people know that this is something we also treat. A lot of times the focus comes with the depression and mood side of what we treat, but the fact that we can so reliably and effectively deal with so many different kinds of what have up to now been reasonably untreatable nerve pain disorders.
Would that be something like nerve pain associated with shingles? Would that be more like if you have a compressed problem with your spine and there's a nerve issue that way?
Kind of both. What we deal with pain from the inflammatory side. So any hyperinflammatory or autoimmune disorder, we can kind of help regulate and kind of pull back, especially with flare-ups.
Okay.
But with chronic nerve stimulation from a pinched nerve or inflamed tissue in the back, we can also address that as well.
You've been talking a little bit about PTSD. The month of November, we always honor our veterans with Veterans Day. You kind of associate PTSD often with active duty service to our country. And I guess one of the challenges with PTSD is that it can kind of show its ugly head, if you will, at unexpected times, which can make dealing with your family and friends and workplace a challenge. So this regulation that you can provide, I'm sure, is very beneficial.
It helps. The thing about our veterans is they have a lot of the skills they need to do very well with what we do, because once we get all of the wiring communicating effectively, the work that goes into it is very much on them. And so our job is to help facilitate this movement towards better mental health. And our veterans and also our first responders we provide specialized scholarship and pricing for our We call it our Heroes Discount, but it's for veterans and first responders, not just the month of November, but all the time.
Because I've talked to you often, I can forget sometimes that there could be some people watching today and they haven't heard you before. So explain a little bit about how these ketamine treatments work. It's a process, right? A course of weeks?
It is a process. Yeah, we usually do a stabilization phase over 2 to 3 weeks. It's a series of infusions. And within a few weeks, we can usually take the patient from their current baseline to a significantly improved state. And then after that, we maintain that with periodic infusions, usually monthly or every other month, just to hold them in that good place while they're working with a counselor, working with their mental health providers, physical therapists where it comes to pain, and we help keep the pain in check.
Kind of like I associate it with somebody who's helping you lose weight. If you can speed up that weight loss a little bit and then have the momentum to keep the diet going, if you will, that's kind of what you do.
Yeah, we get the ball rolling, get them actually moving forward. We call it a remission of symptoms, and like with any disease process, a remission from that disease means the disease is no longer pulling you down. But there's the rebuild, and we support them through while they rebuild to where they get to a point eventually to where hopefully we can remove the need for certain daily medications as well as the need for us.
As I'm showing people your contact information, I'll remind them and you can then elaborate. The education really is your primary focus. The healing can't come if you don't know what you're what you're experiencing. So your consultations initially are at no cost, correct?
Yeah, we don't charge anything. The struggle with no-cost consultations is it's in a full hour of my time. We sit down and we go through your condition and your struggle from start to finish, and we explain what we do in depth. We're very big on education, and we find that when patients are educated, they do better.
And not everyone's going to come in and say, I'll do it today, but they'll know what they can have done.
There's absolutely no pressure to sign up the day of your consultation. Most places that do this free consultation, it's only free if you sign up immediately. With us, I say it's not a timeshare. You don't get a toaster if you sign up today.
Right.
This is education.
And he's a Chattanooga native, so you can find him at Scenic City Neurotherapy, their phone number, address, and website right there on your screen. You don't have to go through the holiday season not feeling your best. Good to see you, Charles.
Thanks so much for having me.
When you walk in the